COVID-19 has changed how we stomp the yard and feel the beat. Now it's time to take the first step that lets us get back to strolling instead of scrolling. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Is it safe?
Should I get it? Is it free?
It's okay to have questions. Now get the facts about COVID-19 vaccines at getvaccineanswers.org so you can make an informed decision for yourself and for your fam.
HBCU marching bands have been trusted messengers on college campuses for decades, uniting college students, alumni, and fans from coast to coast. As COVID-19 hits our campuses hard, it was important for Aid Council and COVID Collaborative to partner with the HBCU marching bands to promote safety and get facts on COVID-19 vaccines.
Stand with the band.
Let's go. Thanks on value.
Good evening, students. Today we have a guest, but I want to say a little bit of something about the program. The Ad Council, who we support in wearing the mask on the game, I think our homecoming, we got that opportunity to help support the Ad Council. This current campaign is up to you. It's designed to acknowledge and validate all communities' concerns and questions, including the Black community, and to encourage people to get the fact so that they can make some formal decisions on themselves and their family about COVID-19 vaccine. So it's playing a big role, okay? It's playing a very big role in HBCUs and in us. But we want everyone to be safe, and we understand. But we have a doctor here that is going to ask, you can ask some questions. He's going to talk a little bit about it. Maybe give you a little more education on the COVID and the variant and what's going on with us in this pandemic, so that we can keep safe, be safe, and have our family safe. So at this particular time, I want to introduce you all to Dr. Alan Dunlap, who is an independent medical practitioner, helping serve on the front lines, working daily around at various hospitals in Montgomery area, and the CMA program director at South University of Montgomery. Dr. Dunlap, please, my guest.
Thank you, Dr. Oliver.
Yes, sir.
Thank you.
All right.
Good afternoon, man. I know what this environment's like, because when I went to undergraduate college, I went to Kentucky State University, so I was in the band also. So I know what you're going through. I know what life's like for you guys. It's kind of hard, but you make things happen. And as Dr. Oliver said, you are a trusted messenger and representative of Alabama State University. Yes, they go to the football game, but they go to see you. If you're not there, people don't like it. And you got to be healthy when you get there. Each one of you, clarinets, trumpets, French horns, trombones, if those sections go down, a big part of the band goes down, correct? And you perform as one integral unit. So it's important that you be healthy. It's important that you keep each other healthy and each other accountable. Therefore, in this era that you're going through right now, COVID, you probably won't see this again for 100 years. Last time it did happen was 1917. What you do this day makes all the difference. It's important that you strive to be healthy and to make sure that your fellow band members are healthy. Some of your band members you're going to be with the rest of your life. Some you may not see after you leave Alabama State, but there are friendships, there are relationships And there's camaraderie that you started right here. And it's important. Any questions? I know there are some.
What can you share about the new variants and why is the Delta variant so bad?
Well, the new variant that we are seeing and have seen since probably late spring, early summer was the Delta variant. That was a variant that actually developed in India. If you look back in the news, if you can see, most of the people in India were not vaccinated. A virus is trying to survive, and it will change its DNA or its RNA so that it can survive whatever environment it's in. So that's why you get different variants. Now, this variant can grow like wildfire if there's no barriers to its growth. And if you think about it, the people in India, they got over 1.2, 1.3 billion people. A lot of them were not vaccinated. So the virus just proliferated there. And when a virus has no barriers to growth, it just grows. It's a parasite. That's all it is. Now, there is one of concern right now. It's only about 10%. They're calling it Delta Plus right now. But there are some variants in different countries because those countries they lack the ability to fight and they lack vaccines. So there are other variants out there. But as you know, when you discover a variant, there's probably already some here in the United States. And Delta virus, the Delta variant was no different. It was already here when people started talking about it overseas. So there are going to be variants. If there's no barriers to their growth and proliferation, they are going to proliferate. Now, what are barriers to proliferation? Vaccination is the only real tool we have right now. Wearing masks, hygiene, those things help. But to vaccinate is probably the key right now.
Are there any side effects of the vaccine?
There are usual side effects like pain at the injection site, maybe redness, discomfort for maybe 24 hours, but they usually subside. Those are the normal things you see when there are vaccinations or any shot that you may get.
My grandfather was a case in that study. He worked as a firefighter where the Tuskegee Airmen trained. He and I were phenomenally close. The syphilis study happened for 40 years. Penicillin was found to be the most effective treatment, but the men were denied the treatment. Interestingly enough, I've had someone tell me that they were concerned about getting the vaccine because of the syphilis study. And I always, try to educate or provide some information about what happened. But then I said, you're talking about something that happened to my family. And I've taken both of my vaccines. I'm doing this for them. Health is greater than wealth, and it's really up to us to take ownership of our health and this story.
Scene 103, take one.
Taking my vaccine and staying safe. That's what you want me to believe.
Of course.
They're saying that the vaccine is 99% effective, right?
Where are you going with this?
What about the one dude?
I want you to get the vaccine because I care. I want you to be safe. If you was to die, man, that would literally kill me, man.
If it made you feel that way, bro, I'll probably do.
I love you, man. I love you too.
If I come in close contact with another student who tested positive for COVID-19, how long before I should go and get tested?
The CDC recommends 5 days. If you're not symptomatic after about 5 days, you're probably not going to get it. Now, if it depends also if that person's symptomatic, even though they're positive, you may not develop symptoms, but it usually take about 5 days. There's a 5 to 7 day window that's recommended for testing.
Can the vaccine affect fertility in men and women or the child after the birth process?
Right now, in studies, there hasn't been any evidence that it does affect fertility.
Besides wearing a mask, how can I, or what can I do to protect myself on the road and on campus?
Social distancing, if you can, but it's kind of hard like this, right? Hygiene. And I say, if you think about washing your hand, wash your hands. Make sure you know sort of the status of everybody around you. If you're around someone that you don't know, definitely keep your mask on and keep the hygiene up. It's going to be difficult to know because nobody walks around with the sign saying, I have COVID-19. So I would say assume everybody does. And follow your social distancing, your mask, and your hygiene.
Hi, I'm Dr. Cindy, and I'm here with Asha. What would be the thing that makes you say, you know what, now's the time?
I've been on the fence for a while about whether to get the vaccine or not, based on, things that I've heard, things that I've seen. Seeing those kind of things just gets you a little scared. It's like, I think everybody should have a choice. Could the vaccine possibly affect my ability to have kids in the future?
Here's the real kicker. If someone got COVID-19, the illness, and they were pregnant, their chance of miscarriage goes up by over 3 times as much.
I didn't think about COVID-19 possibly affecting your reproductive system because my mom, she was barely able to have kids. It was a miracle that I was able to be here. It was very important for me to know that, and now I am a lot more secure in getting the vaccine than I was.
It's important that we recognize that we need to protect ourselves, because if we don't protect ourselves, who can we count on?
How has the pandemic affected my band program? Because it's really crazy, but we have to make a lot of changes, and we have to adjust a lot with our students. And because of the fact that we have to wear the mask and the fact that we have to keep our social distance, we were able to adjust to all that. And because of the pandemic, it added more work to get them to understand what they need to do as students. But we end up making it happen. But it affected us by having to wear the mask all the time, but taking them off when we're playing, but putting them back on as soon as we stop playing. But we made it happen. We adjusted to it, and we refused to let the pandemic take away what we love to do. Going on the road with COVID protocol and the pandemic going on, we have to make adjustment there too. Normally, I travel with 5 coaches, buses, but this year I decided to add an extra bus so that we will have more space, more room to separate the students a little bit more, and that helped out a lot. But I'm also proud because 85% of my students have gotten the vaccine, and that helped a lot to know that. And I did know because it's not mandatory, we just only recommend, but they felt compelled enough to say, hey, we want to keep our program alive. And we know that if something happens, someone get affected, it'll shut us down. So we were able to separate these guys on the bus so that they have enough room in between them, and getting the vaccine helped out a lot.
GetVaccineAnswers.org.